just cut off the thing. You cut it off. Cut it off and it fell.
Hello. Yes. We are on our second surgery of today. We are doing a breast augmentation. Earlier this morning.
Yeah, and then I saw it.
Okay. Play vocal house.
Hello, thanks for joining us. We are on our second surgery of the day. We are doing a breast augmentation. Earlier we had a neck lift and a facelift.
You want a body? Or the right?
Hi Laura, thanks for joining us on YouTube. For those of you who aren't aware, we are also live on YouTube today for this surgery, for that breast augmentation. So if you'd like to join us over there, it's going to be at Dr. Jeneby Plastic Surgery. And there on YouTube, you guys can actually see the surgery as it's taking place if y'all are interested. Or you can find it in our link tree. It's going to be linked there. And it'll take you to other social media platforms like our TikTok, our Instagram, our other surgeons. You may also be able to find them as well. Thanks for joining us. This is our second surgery of the day. Again, we're just getting started. Feel free to comment any questions down below. Be happy to answer them or have our surgeons answer any of those questions you may have.
We're not going to do the breast lift on this one. We're doing this first, and I'll do the band later. Breast lift later, but I'm thinking.
No. I heard that the.
Oh, no, that's what's coming back, yeah?
Yeah.
Being negative or protein positive? So, nicotine is yeah.
Metabolites are there, but the actual.
The protein is actually a better.
Yeah, it's longer.
Longer acting. The protein nicotine is better.
Thanks for joining us. We are doing a breast augmentation, so we're adding implants today. If you guys have any questions about that, feel free to comment those down below. Be happy to answer those for you. This is our second surgery of the day.
Over here.
Thanks for joining us. We appreciate it. We are also live on our YouTube if you guys are interested.
You can push that button right there off.
Yeah. We are also live on our YouTube, so if you guys would like to join us, it's at Dr. Jeneby Plastic Surgery. And then you'll see some of our other surgeons listed there as well. We have Dr. Bam, we have Dr. Latin Heat.
Yes or Cornejo? Yes!
I have my surgery in July and I'm so nervous. Oh no, but that's really exciting. What are you having done? Which surgeon is doing your procedures?
On this one. This is like, once you remove some of this, there's excess breast tissue making this point.
Breast augmentation.
Feel that?
Nice.
This is their natural breast tissue. And she complains
Just like
about
the one that we're
So,
recording today. That's pretty cool. It's going to be really quick. Jeneby, awesome. Well, you will be in good hands. We're excited to have you. Do you have any questions about what that's going to look like? I can tell you that it's going to be a really quick procedure if that's all that you're getting done. It should take less than an hour. Unless you have other things that you're getting done as well.
It depends.
Hey, Dr. J,
Yes.
do you guys offer a shot for the breast, like for pain and stuff?
We do the Expero.
Expro?
If I use the rest of it on this one, what's your name
So,
So yes, we
yeah, we do a
do.
3-day pain reliever called Expero. It helps Dr. Siddiqui over here. I love it. He loves it. Putting it in now, so it has time to hit. So he uses less gas. The patient is happier, less nausea, less sequelae of the narcotics. Everything is good.
Okay,
But the rest
perfect.
of that, we're gonna do it for free.
So if you caught that, Miss Jules, they give a shot, a 3-day shot called Expro. And it's gonna help with
BCC's in the 240.
with the pain. It's gonna help with nausea, and it's long lasting. So yes, and I think they offer different pain meds per surgery and like personal to you and making sure like it's not gonna interfere with any other medications that you may be on. So we take all of that into consideration. But there's no need to worry. They will set you up
best places I've seen it used
to make sure it's
is hemorrhoid surgery.
Oh, yes.
Because it hurts
like
Say.
and then once you
as
get the
least
extra
painful as
old
possible.
I don't even
That's what I'm trying to say.
Wow. But do they
Okay,
do
I'll
that at the
take 2
beginning of the
shots to
day?
go
Yes,
with an
and
extra
then
shot of
for
morphine.
3 days, it's what else
We'll
do you
see. Let's get you here first and then we'll figure all the details out. But we will take care of you.
Not for plastic.
Not worth it. No. And you have to afford it all anyway. Why do you want to pay more money for that?
And we are live on our YouTube as well, you guys. Dr. Genevieve Plastic Surgery. We're just doing a breast augmentation on our patient.
Some tummies, I don't mind it on lipo, but you know, there's always a risk.
There's a little bit of risk, but I think Tylenol is very good. And it's,
I know.
It's gone
Generic.
It's generic, so you don't have to worry about paying 10 times the price.
That's why we could use it in a Pete's hospital.
Offer
I have done it in Pete's Hospital, 15 milligrams per kilo, in as little as 6-month-old and 3. I have used it in 1 month. So you can use it in any age. So it's a very effective drug.
I didn't know you used it in teeth.
Yes.
Because I didn't think their liver was strong enough
They can have
to handle an IV trauma. There's contraindications in teeth.
and the IV format works way better than the field ones.
Yeah, so I've seen those.
Yeah. My screen on Instagram here is frozen. Give me just a second. My pre-op appointment is on July 2nd. Will I receive info on the meds I need to buy, bra, support strap, etc. on that day so I can take extra cash? I'm from out of town.
Several newer studies that say after 65,
July 2nd, I will receive info on meds I need to buy. Yeah, absolutely, Miss Jules. If someone from our team hasn't reached out to you and let you know when you will be getting all of that info, they should have provided you with someone's phone number, someone for your contact. Did that happen? Usually they will go over all of that well before your surgery, but also like the day before they'll get more in depth about what you need to acquire for what you are going under for.
I remember droperidol.
It was historically my
And also, if you want to just private message us here, I can get back to you, or someone else from our team can get back to you if you have any specific questions. But you can always like leave us a call. No, they had me back and forth. Maybe it was a busy day. Yeah, if you want to just reach out, go ahead and DM us here on Instagram about the specifics of anything, like of anything that you have a question about. Be happy to answer that privately. I can talk to someone who knows more about that stuff. I know more of like what's happening in the OR and the processes that happen here. I'm not really, I don't know that much outside, but people from our team should walk you through that process. Since you do have like a few more days, like 2 weeks about, they might just be waiting until you get closer to your date. But I would definitely reach out to that number or private message us here, and I can talk to somebody who can get back in contact with you.
It's 480, right?
Okay, I will. Can you give me ideas on what the surgery for BA will be? Yeah, absolutely. Actually, if you want to join us on our YouTube, you can actually see it happening. You can see Dr. J and you'll see Dr. Phillips,
What was the previous set? 5, 6,
and they are adding the implants right now.
The right was 580.
But basically, to walk you through that process, it's going to be a very quick procedure. So you'll come in. We'll have either Dr. J, sometimes we'll have like another surgeon come in and just help assist. And what's going to happen is Dr. J is going, well, first our anesthesiologist will make sure you are hooked up to anesthesia so that you go under. They'll go in and make sure like you're not going to be sensitive to pain. And then Dr. J will go in and make those incisions where he's going to insert the implants. So usually that will be like under the breast. It's going to be a really quick procedure. He'll just open it up. He might make some room for those implants and then just insert them. He will stitch it up. And then he will go on your other side, do the exact same thing that he did on your left side. And if there's 2 surgeons, obviously it's going to go a lot quicker. But even if it's just one, it's still a really seamless, really quick and speedy procedure. Yeah, we're actually now adding the implants, and then Dr. Phillips. Dr. Phillips is helping Dr. J. It's going to be at Dr. Jeneby Plastic Surgery. If you need help finding it, just come back here. And so right after they add those implants, they go ahead and staple the skin. And then we have, we'll have one of the surgeons go in and do the stitching where the staples were.
Watch the arms.
Okay, sit down.
Yeah, table down and then back up.
Thanks for joining us, you guys, on our Instagram. We are doing a breast augmentation right now. Earlier this morning, we were doing a neck lift and a facelift. This is our second surgery of the day.
That's good.
That's good. Looks pretty good at the top. Love it.
So if you're on our YouTube,
How do you get on our hair and start to pick out this? We have to do a little bit of this, but what do you think?
Trying to get down to it.
Or we'll cut a little skin. What do you say? You can put her down. Thank you. This distance. Back, down. Yep. 11.
if you guys are on our YouTube, you can see that Dr. J and Dr. Phillips have already put the implants inside our patient's breast now. And they're just finishing up. They're going to do some stitching now.
Back that down. Back mine now.
They have the staples that they put in right after they inserted the implants. So we've been live for about 20 minutes. As you can tell, it's pretty quick. And especially when we have two surgeons.
She has you can't feel it, but there's some breastfeeding. Yeah, I'm taking my tissue out. I'm going to biopsy it, but mainly a flat like this. There's no breastfeeding. That's what she needs the most.
Julia Hernandez asks how many CCs. Great question. I'm not sure.
I only have one.
Let me ask.
You want to use
Oh, you don't have one eye.
one right back? Yeah.
How many CCs are these implants?
480.
All
These are
right.
480 boost.
Okay.
Okay.
So if you
The
heard that,
boost tends to be more projecting and have less weight.
got it. All right, Miss Julia, if you heard that, these are 480 boost CCs. So like he said, the boosts tend to be more projecting. So as you can see, hers are just a little bit more angled up and out.
I do not.
Hey, Art, do you have another set of scissors? You don't need it? Lose Dr. Steve.
Oh, so do you have two patients now?
Okay.
No, don't open them.
Never
Don't open
mind, never mind. Thank you.
Good.
Thank you, bro. Sorry.
Just one.
You were hot yesterday.
That's not all the time.
There's one in here. Fuck. Are you comfortable, Phillips?
Again, we are doing a breast augmentation today on our patient.
Yep.
We've got Dr. J on our patient's right side, my left, and Dr. Phillips on our patient's left side. On my right, if you guys are joining us on YouTube. They are just removing some excess skin on our patient's left breast. There at the bottom.
You have that piece out here, though.
I'm getting it right
Oh,
now.
okay.
You can take the most of that if you want. These are bigger cups that are normal.
Yeah, I got it.
Some. Go ahead.
I can start passing this off, correct?
Yeah, you can. It's right breast tissue.
Got it.
Breast tissue and scar.
You got more?
No, there's a little bit more.
All right, I'll wait.
Alright, we are doing a breast augmentation for those of you who are just getting on. We are also live on our YouTube at Dr. Jeneby Plastic Surgery.
So just put it down so you don't drop it.
That's it. Yeah, that's it. All right.
If you'd like to check us out, you would be able to see the surgery happening. You'd be able to see the patient and our surgeons if you're interested.
That I don't have to.
Yeah. Slowly. Scissor.
And you can see on our patient's left side, Dr. Phillips is starting to stitch up where they made that incision, where they inserted the
I
implants.
have a 4 Stratafix, PS2 for the skin.
Yeah. I think we'll do the 305.
Okay.
And Dr. J is just removing some tissue
Yes, you have
from our
to
patient's right breast, as you can
look
see.
like Dr. Wait.
You're on Michael?
Hello. We are on our second surgery of the day. It is a breast augmentation. We have got Dr. Jeneby here, Dr. Boom Boom Pow, and Dr. Bam operating on our lovely patient. So they already added those implants. We had Dr. J removing some tissue from our patient's breast, her right breast on the top, after the implant was already added. And we have her right breast stitched up right now where that incision was made when we added the implant. And now Dr. Phillips is on our patient's left side, just stitching up where that incision was made.
You guys on your last case?
We are also live on YouTube for those of you who are on our Instagram. If you'd like to join us over there,
So then you guys on your last case?
you guys can see the surgery happening. You can see Dr. Jeneby, Dr. Phillips, and of course our patient and what it looks like. If you're interested, it's going to be a Dr. Jeneby plastic surgery. And for those of you who have any more questions or would like to take your interest further, we do have a link tree that is pinned in our bio. You can hit that link and it's going to take you to a lot of different places, but if you look specifically for our get a quote button, it's going to ask for your information, your name, your email, phone number, procedures that you're interested in getting, and of course the surgeon you're interested in having do them. If you fill that out, it's going to be submitted to someone on our team, and they will reach out to you. And then from there, when they give you a call or they text you or email you, it's going to give you an opportunity to ask any questions you may have about similar procedures like this one, or other procedures you may be interested in. We are going to wrap it up pretty soon here, but we will be live later this week, if not later today. Thank you guys so much for joining us. I'll stay on just for a few more minutes to answer any more questions or to get you connected to anyone on our team. Again, this is our second surgery of the day. Earlier this morning, we were live with our first patient. Our patient got a neck lift and a facelift done, a mini facelift done. And what differentiates a mini facelift from a normal facelift, I guess, is the fact that on this patient's facelift, we only did the planes of her face, so on her side, like her cheeks, and we just went behind her ears and up along her hairline, and took that skin and then pulled it back and then stitched it behind her ear, as opposed to doing like her eyelids and her upper eyelids and her lower eyelids. That's what we did on our patient, our first surgery. But as you can see, Dr. Phillips is just wrapping it up on her left side, just doing some stitches where the incision was made earlier to insert those implants. But again, if you guys have any more questions, you guys can fill out that get a quote button. It's gonna ask for your information. Once it's submitted, somebody from our team will reach out to you, and then you can ask away. Once they reach out to you, usually it'll be by phone call, by text, or email. And once that's done, it's a pretty easy, seamless process from there. But for those of you who have stayed with us, we appreciate it. Thanks for engaging with us and tuning in. Like I mentioned, we will be live later this week, if not later today. Again, if you or anyone you know is interested, you can send them our get a quote button or send them to our page. Y'all can fill that out. It's just gonna ask for your information. And from there, we can get you connected with our team. Alright, I'm gonna go ahead and log off. Thank you again. Y'all have a great rest of your day. If we don't see y'all later,